Chris, my question is for you. The AJC released breaking news reports about the audit findings at Georgia Tech, the misuse of millions of tax dollars. If elected, will you look into this case as well as the one that was submitted to you a few years ago from Macon in which you sealed those documents?
Two issues. One, the documents aren't sealed. That's absolutely incorrect, and I appreciate you bringing this up. And Sam knows about this issue as well. That we haven't sealed any documents. Several courts have looked into that case. In that case, and anybody is welcome to come to our office and see what documents that we have. As it relates to Georgia Tech, they are a client of ours, number one, and number two, we have a duty to make sure that that all of our clients follow all state laws. And so I can't comment on that any further, but we obviously have every interest in making sure that tax dollars are being used properly and that individuals that are employed by the state of Georgia are doing what they should be doing. And I appreciate you letting me clarify that. And also I want to say Ken Wright, my state rep, is here too. So I forgot Ken was up a little bit higher, so I want to mention him too.
I have a healthcare question for the whole panel. There was an article in the AJC last Sunday about the critical doctor shortage in Georgia, and according to the Mercatus Center at George Mason, they keep a scorecard on healthcare, and Georgia ranks pretty close to the bottom in healthcare. Now, there's a lot of issues that are out there. There's Medicaid expansion, which I'm sure all of you are against. And so my question is, the issues that are out there are that the special interests, insurance companies, the hospitals, they're preventing good legislation from being passed in this state, certificate of need reform, protecting new initiatives like direct primary care. What would you say about your positions on helping to advance healthcare in Georgia?
That's a great question. Obviously, it's one that we have gotten for, I guess I keep saying 15 months now in the gubernatorial campaign, and my wife reminded me this morning it's been 17 months. But look, that's one of the most difficult issues that we're facing. And as somebody that's been in the private sector for over 30 years as a small business person, no one knows that better than me. Being on the trail for 15 months, it doesn't matter where you go. It doesn't matter what zip code someone lives in. Their health insurance is astronomical, especially people that are not involved in some sort of government-type health care plan or working for, a large employer like a Delta Airlines or somebody like that. People that are small business folks, working Georgians out there, if they even have health insurance out there, it is costing them a small fortune. I had lunch with the guy on Friday that was telling me he is paying $3,000 a month for his plan, and he has a $10,000 deductible. Now, that is about the highest one I've heard, quite honestly, but I've talked to many families across the state that are paying anywhere from $1,200 to $2,000 a month with a $5,000 deductible. Well, most working Georgians cannot afford that. That is outrageous. And the idea of taking more government money and throwing it at a problem that is not working is outrageous. And the Democrats are the ones in Washington, D.C. that have blocked health care reform by getting rid of Obamacare. But there's not a lot we can do that at the state level. But to more specifically answer the question, I think what we've got to do is have a multi-pronged approach. Because a lot of the hospitals, I know they're facing a very tough environment in rural Georgia. But let's face it, when the rural Georgia economy is flat or shrinking, it's hard to support a local hospital without government money shoring it up. Well, if there's no investment in the local community, there's not going to be local tax dollars to shore it up. So then they come to the state, and you have a redistribution of tax dollars to support things across the state. I think the better approach is for us to have a governor that is going to work on economic development in every single area of this state, no matter what people's zip code is. Give them access to tools that will help with that, like running high-speed internet. That's something I've been talking about for over 2 years now. Speaker Ralston and the House caucus and Brad and everybody else that's serving in the legislature that's in the room has been working on this year. And look, even people like Deborah, you know, they understand it's important for folks in rural Georgia to have access to the internet. It's not just about jobs and economic development. That's a big part of it. But it's also about the access to be able to have telemedicine, virtual classrooms, you know, virtual surgeries I heard a doctor talk about the other day. We've also got to address doctor shortages. Part of my plan to strengthen rural Georgia, which we put out over a year ago, talks about a lot of those things. One thing is incentivizing how we can get doctors and other healthcare professionals into rural Georgia. It's also incentivizing businesses to do something as simple as you know, getting them to buy transportation to help get their folks to the workforce, but also to get them to health care. Because if people don't have a car, they can't get to a job and they can't get to a health care facility. But we've got to have that investment in rural Georgia to be able to prop up some of the rural hospitals, but also be a governor that's going to work with those local communities to see what else we can do at the state level to help with that. So I think there's a lot of solutions that we can work on, but we need to use as many private sector solutions that are pro job growth, pro private sector. Because look, if young people keep moving out of the local areas where they grew up, because there is no economic opportunities, because they don't have the great quality of life that you have right here in Georgia, they're going to move away. And when the workforce ages out, who's going to fill what jobs there are there? Or who are going to be the customers at that local hospital? So that's a big issue we've got to deal with. The other thing I would say is it's also going to be up to the hospitals to get innovative. And I know many of them are. And many other people are looking at other solutions to solve the problem besides somebody just walking in an emergency room to get help for a common cold where it costs a fortune. So we've got to address that. We've also got to make sure that we're putting Georgians first. You know, I've talked a lot about illegal immigration. I specifically talked about, and I didn't mention this earlier, I'm glad that Chris did, about tracking and deporting criminal illegals. BJ Pack, a federal prosecutor, said publicly, Georgia has become a distribution hub to the Mexican drug cartel. There's no question that we have 70-something thousand street gang members in Georgia. And somebody in the AJC article the other day on that was talking like, well, that's not that big a deal. There's only 10% of the crimes or whatever going on by street gangs. I would disagree with that. But, I mean, there is no doubt that they're carjackings, drug deals, sex trafficking. All this is driven by drugs and money. And we are going to be a ticket that is going to go after that because we must keep our families safe. But it's also people are outraged when non-citizens can go into our health care facilities and get free health care. And our own people are getting priced out of the market. I mean, that's as ridiculous as Stacey Abrams wanting to give the Hope Scholarship to those that are here illegal. We have got to put Georgians first and have real free market solutions to the problem. And that is what I will do, and that is what this ticket's going to do as your next administration.
My name is John Goldman. I'm a solo practicing rheumatologist in Sandy Springs. I am a small business person. My concern is we're losing the patients, as you pointed out, are getting killed by the programs. A lot of times we're told, well, these programs are from the U.S. government, not locally. But we're losing doctors. I'm a solo practicing rheumatologist. A lot of my colleagues have just said these stupid electronic health records, which really don't take care of patients and focus away from the patient, are just raping health care. We are getting into the point where we can't keep physicians. We're talking about a physician shortage. You could keep a lot of very good physicians if we could do something about this. Now, you're saying, well, this isn't a state issue. And I'm saying, listen, I live in Georgia. This is a state issue. And whether we can do something to influence that with our representatives, that's great. But we need to make sure that there's focus because we shouldn't be losing. We're losing these people who are the great physicians, and this is something that we're just losing this type of expertise, and we should not be. So I want to know what you can do for both of those problems.
So what is the specific question again?
Well, there's a lot of problems. We're losing physicians because of the central programs. What can we do to keep local physicians in practice in Georgia?
What central program are you talking about?
I feel like Medicare, Medicaid, Obamacare, all that's nonsense. And I realize that's central. But we're losing physicians here in Georgia. We're having a physician shortage, and we've got excellent physicians that are just saying the heck with it and throwing up their hands.
So you're talking about Medicaid reimbursements?
I'm talking about solo practice and any type of reimbursement, any type of way to practice medicine.
Well, for state government, you're talking about, I guess, Medicaid reimbursement, correct?
I'm talking about all of practice in Georgia. I understand where your focus is, but you need to know what the physician's focus is.
Well, I can specifically talk to Medicaid, and Jeff may want to as well. But look, throwing more government money at it is not going to be a solution for that, because we're never going to have enough money if we can continue to go down that path, I believe. So what I want to do as governor, and I've been saying this for a very long time, is go in. We've got to have more private sector competition to lower cost. I absolutely believe that we can take a tack as the next administration and look and see how we can squeeze and lower costs by bringing in innovation and technology from the private sector. I've talked to many people that have great ideas. I just met with somebody last week. I think it was Thursday or Friday. I can't remember. Great innovation that they say will absolutely lower costs. This is not a pipe dream. It is a startup company, but they have $400 million of revenue. So these are real life solutions out there. There are, I believe, special interests that are holding up some private sector solutions in government that we can tackle. And as you all know, I was not the special interest candidate in the governor's race. So I have made a commitment to open up the free market in government to find solutions that will lower cost to Medicaid. Well, if you lower cost and you got more money, you can raise provider rates and look at some of the issues that are frustrating doctors right now. But I talked to another guy last week, said he went in to get a procedure, called to see how much it was going to cost to do it through his insurance. He had a high deductible insurance plan. It was an outpatient surgery type thing. It was going to cost him $3,000. He said, well, what if I just pay you cash? $600. So there's some sort of gap there that we've got to focus on. And that is what I'm committed to doing as governor.
So let's take on Medicaid expansion. My professional career is a healthcare background, and in the legislature it was the most passionate issue I had. So I asked lots of questions about Medicaid expansion, providers and hospital systems and everybody else. Here's the cold hard facts about Medicaid expansion, and you're going to hear a little bit about this in your race. You already know that. The other side wants to expand Medicaid here in Georgia, but the problem is if you're a provider and you all of a sudden have a new batch of customers that you're going to see, you still lose 20 cents on every dollar. Right? So that Band-Aid you put on that patient only reimburses you 80% of cost. And so what that's doing is kicking the can down the road, not measured in years but months. And that can, as soon as you get to it in 12, 15, 18 months, is going to be a concrete pier that you can't kick anymore. And you're not fixing the problem, you're making it worse. Here's what I'll tell you about your industry. Here's the feedback I've gotten from doctors from all over the state. And I don't claim to have the perfect answer, but I can guarantee it's not going to be rooted in bigger, better government. It's going to be rooted in the free markets. It's going to be letting doctors and providers and hospital systems to be able to compete in a free market space that allows you to go do what you want to do and the people that you hire to do. And let's go practice medicine. Right? Let's go compete for your patient's business and to go do what you want to do. I think we have a neat opportunity here in Georgia. The way I kind of see what's going on at the national level, there's a lot of national issues around healthcare that still have to be solved, right? And I hope they continue to put a level of intensity that surprises us all on that going forward, because it's a big issue. But I think there's some opportunities here in Georgia for us to lead on this and to ask those folks that represent us, Johnny and David and the other folks that are up there working for us every single day, to ask them to allow us to innovate here in Georgia. Let us go be creative. Let us find ways that create access to health care, right? Because that's what this is about. This is about access to health care. You know, does it make sense to go build a 500-bed hospital in a town that's got 4,000 people in it? The answer is no. But does it make sense to be able to have access to health care so that community can grow and to accomplish the business objectives that that community needs to? So I think that we ought to have more free markets than bigger government around health care. I think Georgia could be a leader in that.
Here's what I'm doing. I filed a lawsuit with 17 other states challenging the constitutionality of the ACA or Obamacare. And here's why. Chief, and I'll tell you the legal reason and then practically what the result's going to be. The legal reason is this. When the ACA was passed and Obamacare was passed, Georgia joined a number of states, Sam was one of them, to say we're going to challenge the constitutionality. Supreme Court said no, it is constitutional, but because Congress's taxation power, okay? So some folks were really happy about that. Some people were really unhappy about it, but we lived with it because that's what the rule of law said. This is what the Supreme Court said. Well, when the tax cut was passed in December, that taxation power went away. So the one thing the Supreme Court said made the ACA constitutional is no longer there. So we filed suit. Now, some people are saying because from a policy perspective, I don't want there to be pre-existing conditions covered, that I'm anti-pre-existing condition. No, what I'm anti is unconstitutional federal statutes. So what happens? Let's say the court, and I honestly believe we are right. I believe this is an unconstitutional, now federal overlay. That goes away. Then Congress and the states and the private sector have to come back and do it right. Is that a guarantee? No, it isn't a guarantee. But I do know this. It isn't working now from a policy perspective. I can't keep you as my doctor if I want to. I don't have a lot of choice because folks have gone away. There needs to be more competition, and I hope pre-existing conditions are part of it. But let me tell you one of the things that we're working on with former Congressman Price, former HHS Secretary Price, that's association healthcare plans. Back in the late 2000s when I was with Senator Isaacson, he pushed this because he was a realtor. And because it was so expensive for realtors or dentists or construction workers or caterers to pool together just within their own industry, but then let alone pair up with others. Well, that's what we are pushing for. And back in the late 2000s, the other side voted, everybody said it's got to be about access. We have 20 to 40 million folks that don't have health care coverage. This would have taken a huge chunk out of it, but the other side voted no. And the reason is it wasn't about coverage. It was about a single-payer health care system. So if this lawsuit is successful, we're going to have to go back and do it again, but with a Republican Congress and with a Republican president. Hopefully there's more free market principles that are a part of it, and we got to get it right this time.
One of the subjects that I'm very passionate about is education of our children here in the public school systems. And we think, there's a group that I'm working with, that the urban school districts are getting too big to provide quality education for our children, and the Constitution prevents new school districts. Do you have any plans to provide more local control to our schools?
Well, I would just say I haven't looked at that specific issue, but I have run my whole campaign saying we need to give local decision makers more local control. I believe, I have railed as Secretary of State, as you all know, about federal intervention on many things. But I also believe that the state at times has done a lot of that too, meant well, but for somebody that literally does business in all 159 counties in the state as Secretary of State, working with every elections office there, I've been to almost every county elections office in the state. There is not a one-size-fits-all solution to what counties are doing. We saw that this week in Randolph County. Even though it took the New York Times and the Washington Post and CNN a week to finally get the truth of the matter, that we told them beforehand it was a bad idea to consolidate precincts this close to an election, even though it was a local control issue, which literally took them a week to figure out. and the local board voted that down. But I feel the same way in education. I mean, nobody knows your district better than you all do, your local school boards. I'm going to be a governor that is going to work with Jeff Duncan and the legislature to try to take off some state mandates. I think one of the things that we absolutely need to look at is the amount of testing that we're doing. I know that's been a hot button issue, and allow local control in education.
I think the greatest gift we can give a child in the state of Georgia is a quality K through 12 education. We need parents partnerships. We need communities partnerships. The state can't do it alone, and if we do, we'll never be able to afford it, nor have the end product that we want, or businesses need to have a workforce ready to take on the challenges of the 21st century. Communities are going to be a big part of it. Brian and I have stressed K through 12 education and looking for ways for communities to be involved in that. I have unique perspective. I've got 3 kids in a public school system, a 16-year-old, a 12-year-old, and an 8-year-old, so I watch it. And I watch what happens when you get education right. I live in Forsyth County. We have one of the best public school systems in the entire, maybe even the country. And we're the 7th fastest growing county because of it. So when you get education right, it absolutely is a cornerstone for economic development. We're going to make sure that Georgia is a leader nationally as to how we do this, and I think communities are going to partner with us as we take the steps forward.
I'd like to show you, 4 gentlemen, a program that I participated in for 10 years that will increase access to health care at a very low cost to everybody, including the patient, and most importantly, to the taxpayers of the state of Georgia. For 10 years, I lived in Naples, Florida. And in our neighboring state of Florida passed a law called the Sovereign Immunity Act. And as a result of that, a retired dermatologist started a clinic called the Neighborhood Health Clinic. Now, you may not think so, but even Naples, Florida has a lot of poor people in it. They could come and get their office visit, any surgery, any diagnostics, and all of their medication for whatever they made for 1 hour's work. If they made $8 an hour, they paid $8. If they paid $10 an hour, if they made $10, they paid $10. The question is, would you support an act that enabled that program? And that act was the Sovereign Immunity Act of the state of Florida, which said that any patient that gets treated at a clinic like that must sign a waiver that if he sues for any alleged malpractice, he must sue the state of Florida, not the individual physician. And therefore, the physicians who worked there did not have to carry extraordinarily expensive or any malpractice insurance. None. That's the Sovereign Immunity Act, and that will do a lot to help this state.
I have not heard the specific as far as that go, the specifics of that policy proposal. To me, that seems fascinating. That's an interesting proposal to look into. And of course, whatever's duly passed by the legislature, signed by the governor, I'd be happy to support. If it's from, so y'all see how I move that on? From a sovereign immunity perspective, there's a kind of a different principle that we've got, but I've not heard of it in the healthcare realm as that was just brought up.
Well, to that point, though, a few years ago, I introduced a bill, and really I was talking to several health innovators, free market conservatives, about health innovations. And one of the things that they talked about was that in Gainesville, Georgia, we have one of the largest charity care networks because doctors can practice there and not be concerned about lawsuits. So it's a charity care. So it's probably a little bit different twist than what you were just describing, but we do have something in Georgia right now that went into effect before I was in the General Assembly, and it's a great success story.
My question has to do with small business. I've been involved in the entrepreneurial investor business for over 20 years, and one of the things about the Georgia investment community is it's fragmented. There's silos of investors and folks looking for money out there that there's no connection between them. You go to Columbus, you get one set. You go to North Atlanta, you get another. What I want to know is how you might suggest that the investment community be more broad-based and have some communication one to the other, so that a entrepreneur looking for money in one area that he may not get access, they could refer him to another where he might.
Well, I'll just give you a brief answer on that, but first I'll say that I will not be a candidate like Stacey Abrams that wants to take $10 million of your $10 million of your tax dollars and give to private sector startups. There's plenty of private sector money out there. I spent the first probably 3 years I was Secretary of State just right here in the local neighborhood of Metro Atlanta, learning about all these different groups that are out there that are connecting innovators with money people. I think what we've got to continue to do as a state, or what I'm going to do from a gubernatorial standpoint, is be somebody that will be a promoter to continue to bring and to continue to get more folks that are here to invest their money locally. You know, much like the Georgia Grown program in agriculture, we've got to continue to educate people that, look, there is a vibrant, innovative startup community here. You know, you don't have to go somewhere else to invest your money. We need to convince people in California, in Boston, in North Carolina, Florida, wherever it is, to look to Georgia. Look to our innovators that are coming out of incubators, coming out of Georgia Tech, coming out of the private sector, to let that private sector market work. If there's ways that we could help facilitate that through technology, I'd be willing to look at that, but I would lean toward the private sector doing that, and I know there's a lot of people here that are.
The greatest thing we can do as a state for any business, whether it's your business, Jim, or anybody else's business, is continue to promote a strong economy here in Georgia and to create opportunities for jobs and for us to be able to have a workforce that's ready and allow the economy to take control. I have a venture capital background to some extent, and so access to capital is best solved in the free markets. The free markets is better at picking winners than anybody I've ever met in a cube in downtown Atlanta in my entire life, and that might hurt some feelings. But the free markets figures it out. And here's the trappings. There's a mentality inside government, not just here in Georgia, but nationally. The mentality is that we, the government, are the solution for everything. So if we make it just an ounce bigger and an ounce shinier, we'll solve it. We believe it's we the people. That's why we won these elections, because we are behind the people. We believe we the people are going to solve those solutions. And if you just look in short snippets, it's sometimes hard to see that free markets is the best solution. But if you give it just a little bit of time, the free markets gets it right. And I think capital and growth and investment is definitely something that the free markets need to be better at. Thank you.
I wonder how you deal with that, like how you deal with the media influence.
I think you may be asking how we deal with fake news.
Exactly.
I think we talked a little bit about that earlier. I can't remember who said it. I think it may have been Chris Carr, but he said the good thing is we have the truth on our side, and that's our job for the next few months, is to get that truth out there.